22 out of every 100,000 live births result in maternal death. 90% of these are preventable. Welcome, everyone. We are Team ParaNormal Distribution from VCU, and our presentation on maternal mortality focuses on the impact access and equities has on preventable maternal deaths in Virginia. My name is David Sprache, and I am a business system analyst for VCU.
My name is Ashley Christakis. I'm a research analyst in enrollment research and evaluation.
I'm Karen Horner, business intelligence analyst for finance and budget.
My name is Kristen Smith, and I'm the director of enrollment research and evaluation.
7 million women of childbearing age live in an area where there is no or limited access to maternity care. 1 in 8 babies are born in areas with limited to no access to maternity care.
And so how does Virginia compare nationally? And to be clear, we're defining maternal mortality with the CDC definition, which includes deaths of women while pregnant or within 42 days of the termination of pregnancy. The United States average is 20.4 deaths per 100,000 live births, and you can see here that Virginia is slightly higher than that at 22.3.
Maternal vulnerability, as reported by Sturgo Venture, is when women are vulnerable to poor maternal health outcomes, using a 0 to 100 scale where 0 is the least vulnerable and 100 is the most vulnerable. In Virginia, the highest vulnerabilities were seen in reproductive health care, physical health, and general health care. Virginia ranks 19th in the nation with an overall vulnerability score of 36.
So as we look closer into Virginia, we wanted to understand where the holes in maternity care existed. The March of Dimes, an organization that focuses on infant and maternal health care, defines a maternity care desert as any county in the United States without a hospital or birth center offering obstetric care and without any obstetric providers. With this context, we reviewed the deserts in Virginia and saw that these existed along the peripheral and within central Virginia. Looking further into why these areas were deserts, we saw a small number of hospitals and birth centers scattered around Virginia. In Virginia, 70.7 counties have no hospital or birth center offering maternity care. But it would appear that the major factor with the distribution was the distribution of OB providers throughout the state. In Virginia, 32.3 counties had not a single obstetric provider.
And so looking at prenatal care in Virginia and the availability of access across the state, according to the March of Dimes, 19.6% of mothers receive no prenatal care in the first trimester, some of whom continue to receive no prenatal care throughout the entire pregnancy. And this is obviously a concern because delaying that care puts the baby and the mother at great risk of serious medical problems, including maternal mortality, maternal death. So we were interested in learning more about the known barriers to seeking that prenatal care, to seeking healthcare in general. And the primary barriers we found in our research were cost, typically related to the lack of insurance or the need to prioritize work over receiving healthcare, convenience, transportation, other childcare coverage, or available appointment hours, psychological and psychosocial fears, such as the fear of being judged or fear of others' reactions, and lastly, fear of legal prosecution, typically related to substance abuse or an undocumented residency status.
So how do we resolve these barriers and improve healthcare access for mothers? Mobile healthcare units are already in use in Virginia. They are limited, but have the potential to expand to serve to a wider, more diverse population. Existing mobile healthcare units offer primary care, preventative screenings, dental services, specialty care, including mental health, mammograms, and ophthalmology. Research of adapted mobile health units found that patients were more likely to receive prenatal care earlier in their pregnancy. They reported lower rates of preterm health issues and overall better health outcomes for mother and child. Similar or greater results could be achieved in Virginia by modifying mobile health units to include pregnancy interventions with pre and post care, primary health care, including mental and social health interventions, newborn care and interventions, financial assistance, and human resources. Mobile healthcare units decrease barriers in healthcare, including those that impact maternal mortality, by providing patient-centered care that is tailored to the community it serves, promoting health and social education, empowering patients through advocacy programs and support services, and fostering trusting, reliable relationships. Using a diverse group of healthcare workers who are trained in cultural competencies, specialized in the needs of their community, including mental health, physical health, social work, and more, and by providing convenient services in a comfortable setting, with stability and consistency of service provision within communities, convenience of having a service that is accessible and affordable, and by offering a space that is comfortable and less intimidating than conventional care spaces.
Remember that 90% of maternal deaths are preventable. By expanding mobile healthcare units, we can save lives. Thank you for your time.